All right, cool. Thanks for jumping on, guys. Welcome. We're going to jump right into it. Will both of you just introduce yourselves a little bit and, talk a little bit about your practice, and we'll do the whole, just get up close to the mic and let it eat.
That sounds good. Thanks for being here, for having us, Kyle.
Sure.
My name is Matt Bitsko, psychologist at Summit Emotional Health. So I have been at Summit. I'm the founder and CEO of Summit Emotional Health. We're about to experience our 10th birthday here in the new year.
So I'm Mary Moose Herring. I work for Ortho Virginia. I do sports medicine, orthopedics. I'm fellowship trained in sports. My background is I grew up in Boone. My dad was an orthopedic surgeon. He was the team doctor for Appalachian State. So I got to spend my childhood prowling the sidelines, being a sports medicine doc at a young age, and really fell in love with it because he was my role model, through and through. So I grew up thinking I wanted to be him. So went to school, left school, and joined him for 8 years. I was a team doc for Appalachian State for 8 years, and then he retired, and I realized that's not what I wanted. And so I went to work at UNC. I worked at UNC for 2 or 3 years and realized that if Mom ain't happy, nobody's happy. She was from Richmond. I said, no way am I going back to Richmond. No way. I clicked my heels together, and I've been here since 2012. And it's fantastic because I can do sports. I can do shoulder. I'm also in my hobby. I'm an endurance athlete. I've been able to race and train all over the world. I've been blessed to go to Kona 3 times. I've scorched my heart, scorched my brain, and I love it.
Love it. Fantastic. I'm from Asheville originally, so not too far away. So I got only there for 4, but right. I lost the accent pretty good. So
I still have it.
You still got a little bit. Yeah, you still got a little bit. I wish I had it, man. My accent was nice when I was a kid. Cool. Why don't we start? We'll talk ACL stuff a little bit. We'll talk about the psychology of all that. We'll just bounce around. It was kind of funny timing because I saw your Instagram video yesterday and watched it in terms of the time frames and stuff. But I do think it's important because we're lucky enough to be able to talk to patients and whiteboard it out for an extended period of time. But, I'm a new athlete coming in, just tore my ACL. You don't have to go into the extreme detail or whatever if you don't want to that the video was. But what do you like to do from a conversation standpoint? How do you set timetables as well?
So when you're evaluating a new ACL, it's pretty obvious because 9 times out of 10 when they get in the clinic, they have been going 60 miles an hour. They've been playing for their club team, their high school team, whatever. And now you take this athlete, whatever level, they've gone from 60 miles an hour to 0, and they are devastated because some of their teammates have had ACLs. They've heard about ACLs. And so the first visit for us, hopefully, is to plain explain what an ACL tear is and to plain explain what the time frame is. And the time frame is devastating for them. You take a 17-year-old female who's been playing soccer and her only desire is to go play soccer at school, and she's torn her ACL, and I have to tell her she will not be game shape, ready to roll like she wants to for about 1 year. So you tell a 17-year-old they can't do something for a year, it explodes their world. So that first conversation, again, is just to provide them information, to tell them it's going to be okay. 92% get back to pre-injury level. I'll do my part. They'll do their part, and it's going to be a long time.
Yeah, love it. And I appreciate you, frankly, saying 12 because I think it got pretty tiresome for us on our end of things for a while, hearing 8 to 9 all the time, and just certainly at a high level, that's just not realistic. I think in most cases. So. And then surgery happens, they're coming back, they're seeing you, stitches are out, we're 2 weeks deep, we're getting into that protection phase. What do you think's important in terms of your discussion with the athlete? And maybe not so much healing time frames and all that, but almost what are some of the soft skills maybe that you use in terms of that phase?
So I love the whiteboard. Absolutely, love the whiteboard. And how do you eat an elephant one bite at a time? So hopefully a discussion we've had from them is there are phases of healing, okay? And I only want them to think through the phase they're in. And so that first phase to me is a maximum protection phase. And the reason is their quad is down, they're mad, their parents. They're not playing soccer. They're crying in the rooms at night. I only want them to get through phase 1. And for me, what phase 1 means, if the meniscus and the ACL and all that we feel is solid, is 4 to 6 weeks, depending on the graft type, right? And all I care about in phase 1 is full extension, flexion to 120 or so, and their quads and hamstrings are starting to fire.
Yep.
Other goals in phase 1: reconnect with their friends, read a book, learn how to cook, set other goals in phase 1 that is not sports or knee related. Because we have these kids and they've gone after these goals all their lives, and all of a sudden they're thinking a year away. If they can set a goal of 800 sit-ups or just something like that. After 5 or 6 weeks, that's their goal. So we're not thinking about a year. We're thinking about 6 weeks down the road. So that's phase 1. And I think a huge component of phase 1 is mental.
Leads right into it. So that's the next question, right, Matt? For you is like, if we break those 2 phases up, from your perspective, what would you do? What can we do pre-surgery? And maybe what are some tactics in terms of like phase 1, the first 6 weeks after? Like, what can we think about to prepare the athlete and then to try to make that transition as smooth as possible?
Yeah, I think, and let me just state, I'm kind of like the hair club for men guy. I'm not just the president, but I'm a customer, right? So I'm speaking as the dad of an athlete who recently went through an ACL tear and reconstruction. But I've been helping these kind of athletes for years and years, so I got to see both sides of it. I think the best thing a mental health professional can do is really be informed of what the process is. Like, you really have to have that deeper dive. So you need to have relationships with things like with both you gentlemen to know what it is, because you can't have to have the patient or the parents explain it to you. They have to know that you're coming from that place of knowledge. And we're actually trying to do the same thing. When I'm working with any client, but especially with a client in this situation, we're trying to figure out not only what are their skills and what are their strengths, but their weaknesses. But we're trying to be like, all right, we're trying to stay in the present tense, even though your mind and your fears are going to pull you to those 12 months really down the line. And they're going to look backwards a little bit. And there's going to be some frustration and guilt and shame and anger about, like, maybe I shouldn't have done this. Why did I do that? What? Because they're going to be asking that why, which comes with any kind of not only injury, but kind of grieving process. So we're going to just kind of sit with them for a little bit, kind of see where they are, going to answer questions. To your point, Moose, we're trying to give them information. One of the things I learned at the childhood cancer clinic, when people are in an elevated state of distress, they need to hear something 3 times before it's even going to have a chance to sink in or to try to do something about it. So when you're with the 17-year-old and you're sitting there and you're patient, you're trying to make sure that they do have an understanding. I do not say, how's that make you feel? In my line of work, in cancer or in athletics, I don't.
Know how it makes them feel.
I don't have to ask them. I don't have to ask them. I got to ask them what they're thinking and what they're feeling and what we can do with it. But I do focus, to really try to answer your question about that, Kyle. I do focus on their time perspective. Are we staying in the present tense? What's your ability for that? When you go to the past, let's kind of bring it back. When you go to the future, let's try to bring it back.
Yeah. I think usually the first couple of weeks for us actually are relatively smooth, because it's just like, man, my nerve block just wore off and this sucks, so make it stop, and then they get 7 days in and it's like, all right, I'm starting to see the leg. I'm not freaked out by the incision anymore. And then it becomes like, all right, what's the rest of
now
this?
what? Let's go.
Now what? Yeah, like so maybe at that 2-week stage, as they get into eventually what starts to look like some level of strength training for us, in the clinic, when they get past like 6 weeks. If you gap week 2 to week 6, for those that haven't gone through something like this, you're still in a brace. You're kind of hopefully unlocked if you don't have a big meniscus repair or something, but you're off crutches. Hopefully we're moving around. Life is looking up a little bit, but now it's like, I did not think my quad was going to do this. I thought that I could be the person on TV that just willed themselves from being an athlete their whole time. I think I'm Adrian Peterson. As it turns out, I'm not. What do I do now? If somebody's kind of freaking out a little bit, like, what's that conversation look like, from your perspective? Or what can we as medical professionals do to help?
I think you're trying to help them understand, and you're trying to help them create their own idea, right? In my line of work, the best idea anybody ever had was their own. And they're sick of people telling them what to do and how to think and how to feel. So I get the chance to slow that down and to explore, like, what are they thinking? What are their hopes? Because you certainly want to lean on that, but what are their fears? And I want to let them to be able to communicate to me and start to speak to me what their narrative is.
Yeah.
Because then I can go with that. And that sounds like something that's a little bit more personable, something that they can do. Even if it's scary and even if it's frustrating, I want them to create and start telling their own story and how they do want to be different and what they do want to commit to your point, Moose. It's like, what are your goals? Like, and what sort of things outside of sport are you going to do that you can start to feel like you're a competent person when you're not feeling like a competent athlete, when that's really been probably a big portion of your identity.
Yeah, I feel like I've probably, and this isn't just in the post-injury, but maybe in that scenario, I would jump to more of a, so do you like to cook or what? Or like I would almost abruptly throw something out there that maybe is way off topic and makes them think, I don't know, like I don't know, Moose, if there are certain ways you like to bring that stuff up, because you already brought it up too, which is great. I probably don't do enough of that early on already. So that's learning point number one, I think. But I don't know, like, how do you, what's maybe the best way to phrase that? I mean, do you just start with what are your goals? Do you, is it humor? Like, I don't know, what are the best ways for us to connect, you think?
Well, I think the three of us in this room, because we have some commonalities of being able to connect and to build a rapport with the client, with the athlete, right? So that's key. And again, I mentioned it, but I'm pretty biased towards it. I'll talk to them not in the very scientific way, but what I'm essentially trying to figure out is what is the extent of their athletic identity. As a psychologist, I love identity formation and development in all realms, but especially with the athlete. The two things I listen for is what is the strength of their athletic identity and what's the exclusivity. Because if there is a lot of exclusivity and like really whether they knew it or not prior to this, like their whole world, their whole friends, their whole activities, even outside of quote unquote sport, have been sport related, that is going to be a difficult. Yeah. So just trying to explore what other interests do you have, you can say, but I always make the analogy of like what bumper stickers are on the back of your car.
Oh, okay.
Right, because that's important enough that you thinking about yourself, but you want other people to know that.
Yeah.
So, are there other things outside of sports, or do all you have is are you and Richmond Kickers and this and that? And if it's just that, I mean, just figure out what your family likes, what you like. Trying to, if they'll allow it, look at this as a brief and temporary. You got to keep saying temporary opportunity to kind of do some of this stuff. Yeah. They might not like that. Yeah. They might bite, but all those things that we can try to throw at them.
Cool. Moose, is there anything else from your end that those conversations that you found to be real helpful?
Yeah, so we talked about phase one, and phase one in my orthopedic mind is those graft fixation points are healing, and I don't typically worry about them in phase one because they hurt. Yeah, their quad's not functioning. They're locked in the brace. They're on crutches, and they are starting to deal with. I'm down. I'm hurting. I can't do what I want to do. I'm going to watch Netflix. I'm going to play on my phone. And so during phase one, it's pretty easy for the physical, not the mental standpoint, but it's pretty easy for the physical standpoint to hold them back. Yeah. In my point of view, phase two, which is what we've gotten into, is from 6 weeks to 10 to 12 weeks, depends on how they do, is the scariest time. Yep. And for me, my two favorite quotes I use in phase two is, even though your mama tells you, you ain't special. Yeah. It takes time.
That's a booner.
Yeah. Exactly. That's a boonism. Even though your mom tells you, you ain't special. Because it takes, physiologically, it takes 6 weeks for the graft to heal, and it takes another 6 weeks to start getting the knee back. Yeah. And my favorite quote during phase two is, don't be a knucklehead. Yeah. Because when they get to phase two, they're like, wow, I've been so good for 6 weeks. I've been on my crutches. I've been on my brace. I've been doing fine. I hate this brace. I hate these crutches. And even though Kyle at Sports Performance says, I got to use it, I ain't using that. I'm not going to use that. No, I feel great because I'm special. Well, guess what? You ain't special. So phase two scares the crap out of me because you take these young kids who were injured, they had their injury time, and now they're getting itchy, right? So we have to reemphasize, stay in your brace. You got to be careful. Don't let your friends, jump on your backs. To stay away from them. So, and I think the most vivid perspective you can give them is have them sit up on the table, show me your quad.
Yep.
And the ACL quad goes wah, 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 and the other quad won't. It's a big quad.
And you're measuring it.
And you're measuring. And you show them they're 4 centimeters down.
Yep.
You don't have the quad strength to protect yourself if you fall down the steps, or you're shooting baskets in the driveway. So don't be a knucklehead. I don't care what your mama says. You ain't special. But that to me scares the crap out of me for phase 2.
Yeah. Yeah, I think sometimes too. I think this is probably more for us on the PT side of things. We see people so much, and you develop such a relationship that you almost have to catch yourself not being the good guy and being like, man, things are cruising. I think in my older years, I've had to be like, oh, you're fine. Like, actually, you know what? Your quad kind of sucks right now, and you're not where you need to be.
Right.
And being the bearer of bad news, you look back and like, man, I should have dropped the hammer a little bit more.
Trying to keep them in the boundaries.
Yeah, just keep them in the boundaries a little bit. Have you had this is an aside, like, have you had many re-ruptures from stupid stuff?
Yeah.
Yeah.
And
I've only had a couple, but.
So I've had to hit people. I'm not going to wear that brace and fall down the steps.
Yep.
I've had mainly high school boys, their friends jump on their back in the hall.
Yep.
And even though they have a brace and they have a crutch, they go crump on the floor. So it happens. And so that's why we preach to them, don't be a knucklehead. And I don't care what your mama says, you ain't special. That to me is phase 2.
Yeah, I think once we get it, the end of phase 2 probably for most of us is like, am I going to run? Or getting close to it.
Yeah.
Any feelings? This is a clinical one, I guess, like 3 months compared to 4 months for you in terms of when should most people return to run if they've had a pretty good process, or it just depends on the person.
So if we've talked about them, they've gotten through phase 2, and they're good, they're making progress. For me, it all depends on how they've progressed through phase 2 and what their quad looks like. And I'll say, 100% certainty, I'm probably not the guy to make that call.
Yep.
You're the guy to make that call because you've seen their single leg balance.
Yep.
You've seen them go through therapy. So I would be very comfortable with somebody starting with a patellar tendon graft, starting to jog straight ahead, flat, predictable ground at 12 weeks if you say it's okay.
Yep.
Because you see their balance and you see their range of motion. With the hamstring graft, it's probably 2 weeks after that.
Yep. Yeah, I think, Matt, too, that goes back to what you said. Unfortunately, you had the front row seat to it, but I think we probably as a staff are trending towards, with some others out there, recommending 16 weeks at that 4 months, at least to set the table probably non-aggressively, and then if they look great, it's just, money on top. Like, hey, you do the stuff right, maybe it's 12, but let's see what you look like at like
After.
12. Yeah, so as we build through that, then it's all about just getting really strong and getting back. Some of the staff here question, I'd say it's a little different surgeon to surgeon, but what do you like to see in terms of return to sport testing? What do you think matters?
Well, I think there's a couple things that matters. I think it takes 1 year for people to be game shape, ready to go, and then they have proprioception of where their knee is in space.
Yep.
You can measure their quad. It can be 90-95%. Their single leg, double leg hop. Their shuttle run can be fine. But if their proprioception is not great and they have no idea, they can't do a single leg stance. They're not ready, right? And I think that's mental. I think is a kid ready to play. Do they have other injuries? Are we protecting the meniscus? Is their MCL loose? Is their LCL loose? There's a lot of different things. So I think it's so individual. And we tend to get to 9 or 10 months, and if the kid or whoever's done a good job, you're starting to throw in some game-specific drills and that kind of stuff.
Yeah.
But that progression from 9 weeks to 12 weeks, or maybe 9 months to 12 months, is absolutely depends on the drive of the kid, how motivated they are, and how their body's responding.
Yeah.
It's
100%. Yeah, I think we're finding, I think a lot of our horizontal forward hop testing is like nonsense. Like bad people can figure out how to be athletes,
Can
cheat. So, we do it because everybody wants to see it in the LSI testing, but like for us, it's a single leg jump to single leg land on a force plate. You'll see them they just look terrible. And then they realize like, oh shit,
I ain't ready.
That's not so good. We included as well. There's a couple of subjective questionnaires, but from your perspective, Matt, like when we assess psychological readiness, let's call it 9 months. Let's just assume surgeon is still pretty cool at pushing somebody field sport wise back. What's important to you if somebody's in the clinic working with you, and what do you think we need to look at? Are there objective measures? Like, what do you think?
Well, I want to go back before we go to the 8 or 9 months to
Sure.
the 3 or 4. I mean, I have a quote from a patient that we all kind of know, and I'll never forget when they were telling me, making that bridge from 3 to 4 months, they sat down and said, all right, Matt, I'm officially transitioned from being in pain to fear. Because that 3 to 4 month mark is when you guys are starting to go, okay, now we're going to open this up. Now we're going to
training now. We're not working on motion.
You
we're
got
training.
it. Yeah. And I love it because, what we ask of the athlete and a little bit of their parents, if the parents are paying attention, but of the athlete, we're asking a huge amount of flexibility. We're essentially asking for the first 3 months, shut up, listen to us, don't be a knucklehead, don't deviate. And then around the fourth month, we say, well, how's it feeling? What do you want to do? And they're like, what? Like, you taught me to be a turtle and to put my head in for a while. Now I got to stick my neck out. Yeah. So a lot of the work I do around month 4 through the 9th month is to really be like, how do we address the fears? What are they? You have to speak them out, right? Which a lot of times these athletes or any person of any age might not have the skills or the comfort to do that.
Yeah, great point.
Right. So like you guys are working through reps. I'll joke with them. Hey, Moose is looking at your knee. Kyle is putting you through these reps. Well, the reps in here, like I want to push you as well. And you need to talk. You need to get it out of the inside, even though you've never done it. You don't like to do it. Like those are the mental reps that I'm trying to do just to get the words out. Yep. Right. But it really is a lot of that is management of fear. Every person and personality is different. You're going to see their strengths. You're going to see their weaknesses because they haven't had to deal with this yet. So it's really how they manage their fear, especially when you guys are in a great way pushing them while asking some of their feedback. Yep. Because now they don't know how much to even trust their body.
Love it. Yeah, I think, the one thing that we think about a lot too, I'm curious of what both of your opinions on this. Like at the end of the day, I would say as a trend, we see some differences in terms of the psychological state of some of our like male athletes compared to female athletes at the end of the day, and maybe some different challenges there. I think that I would say, we tend to have guys that don't know how to talk about fear, I don't know, probably more than some of our girls. I think on the flip side of it, on the back end, maybe there's a little more just general fear from our girls, and maybe that's a good thing in some cases. I think that's where training can fill the gaps. Like high level training does fill the gaps. I don't know. Well, like any thoughts on that? And I say that too. Obviously it's like a weird time to talk about some of that stuff nowadays, it feels like, but it's pretty clear, I think, in the literature sometimes, we know who's tearing ACLs more often. But I don't know, in the process of like 9 months on, do you see a general trend, in sex difference in terms of just stuff that you're worried about or ways that we can fill the gaps with like low hanging fruit?
I'll take this quickly and then you can take it, Moose. I mean, the one thing I would say, and we all do it, from the medical, from the physiological, or the mental, we're always assessing for pre-existing conditions. So if you have a 17-year-old female, was there pre-existing anxiety? Was it a clinical anxiety? Was it subclinical, but was it kind of always there? What's their household like? How do they handle stressors or quote-unquote crises like this? You're learning that along the way, and that's going to play into my treatment plan. You're going to do the same thing when it comes to a 17-year-old boy, if we're going to stereotype with that. But to the point with when they're 9 months out and you've been trying to have this be a safe place that they can talk to you and hopefully open up with some of their fears, some of their hopes and everything else, that's when they might start to max out on their own skills. You're like, all right, because we're about to take this to the next level. For these next 3 months, we're trying to get you back to exactly where you were, and heaven forbid at the 14 or 16-month mark, stronger and better than you were. Yep. And we're trying to see what their mental and emotional abilities are to really kind of take that risk, right? One of my best mentors always said, hey, look, there's 4 things. When you're working with an athlete, there's only 4 things. Do they need more knowledge? Do they need more skills? Do they need more support? Or do they need the ability to take the risk? And that 9-month mark is when you're like, are you ready to take the risk? And are you ready to fall on your face? Maybe not literally, but are you ready? Do you have the emotional stamina to kind of do that? And that's what I'm working with these folks on. And I'm trying to do it in other areas of life. Some of it is very athletic specific. Some is other realms of their life. But I think that risk taking is in a healthy way is what I'm looking at.
Love it.
So, and I also think that's a great point, Matt. I also think at 9 months, that's when we start having the conversation. Why'd you tear your ACL? Is your pelvis weak? Do your knees collapse in? Do you have a flat foot? Were you fatigued? Nutrition's bad. We having your period. All those things are very, very important. And these athletes want to know why, right? And it may not know. It means somebody, did a side tackle, and that's not going to matter male or female. They want to know why.
Absolutely.
And so if you guys, as you work with them, say your knee, your knee collapses in, you have a flat foot. When you drop your butt to plant and turn, your knee looks terrible. That's why you tore your ACL. And if we can give them information at 9 months that they feel like, yes, I will be better on the other side.
Yep.
Right? So if we can help them understand why, I think that's helpful to them. Because now they're saying, well, I've been dealing with this crap for nine months. I'm going to go out the other side a better athlete.
Yep.
My core is stronger. I can jump better. My knee position's better. And that's exciting to them.
Yep.
It's exciting to them. So why is the first point, and then fix it. Fix the problem. Work on your jumping. Work on your running and cutting. And you're gonna, in my opinion, you're gonna build a foundation from 9 months to 12 months to be able to play. And I don't really see a difference in male and female. I think the difference in my mind is some young adults, even adults, have a larger foundation to start with.
Yeah.
So it's easier for them to build this giant foundation from 9 to 12 months. Are you starting with an athletic kid who never thought about anything except for just going all out?
Yep.
So from 9 to 12 months, if we can help them understand why, if they can fix it and they can build a foundation from either a zero foundation or a broad foundation, in my mind, you take these athletes who just want to be better.
Yep. Yeah, I think preparing around probably month 6 on, when we start to do change of direction stuff in practice. I mean, this should be a no-brainer, but moving from, like you said, we've got essentially 4 months of nothing but block practice consistently, with very little random practice. Right. And probably a lot of our athletes have never heard the term, random practice. Yeah. I'm in the golf world pretty heavily. God knows everyone, has very little random practice and doesn't see transferable results because of it. I think that's one thing when we whiteboarded out too. It's like the time frame between 6 to 9 and especially 9 to 12, like you said, Moose, like, it's time to get a little bit sketchy, I think. That's probably the only difference I think that we see just between the sex stuff. It has almost nothing to do with the actual process. Oftentimes it's probably just like not as many of our girls are used to training in the strength and conditioning piece, which maybe, we kind of know is part of the deal. And I think that's how we've got to be, that's just where we got to be good at.
And I think one key point that I've seen at Appalachian, I've seen it through all the high school athletes I work at, and see athletes with it now. Not everybody is supposed to be on a big, beefy football program.
Yep.
These young females, or even soccer players or endurance athletes, don't need to be big and bulky. So the other issue from 9 to 12 months, as you build that foundation is going to be very specific to what your goals are. Yeah. Right. And a lot of these kids have been in high school programs, which there's nothing against them, but the strength and conditioning people there are all about, you got to be able to bench press, you got to be able to deadlift, and you got to be able to squat. That may not be the best focus for a female lacrosse player or even a soccer player.
Yeah, could not agree more. Could not agree more. We get the person that's struggling. It's month 11. Still maybe a little swollen from time to time. Maybe they still feel like they're a little bit stiff. Mm-hmm. The confidence is not there. What do we do at that point? Like, what do you think in terms of, do we just give them more runway? I'm usually trying to obviously set the conversation. Like, look, you might be a little bit slower, but that's fine. We want to do this one time and not twice. And we have a problem with twice, obviously. You get that 11 to 12 monther that's still just not quite confident. How do you go about that? What can we do a better job with as PTs? And Matt, for you as well, what's the best way for us medically to have the conversation with the athlete? Hey, there are resources out here outside of what you think of that are actually maybe the most important thing right now.
Yeah. Yeah, well, certainly if they haven't been utilizing a mental health person in any sort of way. I mean, usually athletes, and if there's been an injury, they can use that as a good enough excuse. Like even if someone knows, hey, I'm going to talk to someone, that it's a little bit, and they might be able to do it at that point as well. You know, the first thing that popped in my mind, Kyle, when you said it, is some of the work I do with them, yes, it's about confidence. Yes, about just getting back into being comfortable with the flow of the game. And I'll explore with them. They got to tell me their own story. I got ideas. I was an athlete, but it's got to come from them. At that point, they're often thinking too much because that's what we've been training them to do.
Right.
You know, and to be aware and to think this and then we almost have to kind of decouple, and we need to be like, all right, do you remember? You got to make it up, even if you can't. But can you remember a time when you didn't think, you just acted? When you just did? What's the flow on the field? You weren't overly thinking about, what's this pass? Did I trap? How's my foot thinking? Oh my God, is someone coming? You know, at that point, it's really trying to work on thinking less and kind of slowing down that machinery, trying to get them. I think the flow state is a little bit overused, but we figure out whatever they think as far as what it means just to kind of engage in the game. Think less, enjoy it, smile. We keep mantras very simple. You know, as far as what do you want to do when you're out there? There's one or two max, kind of like a swing thought in golf.
Sure.
Right? And you're just trying to keep it simple. You're trying to really see if they can get back to enjoying it.
Yeah. Yeah, I think that's great. I think when it comes to like setting up practice for some of these athletes, because I think that's another scary, mark there, right? It's like, I mean, hopefully we're not just clearing somebody, and like, oh, yep, knee looks good. Let's get back to it. And it's like, oh, I don't know what that means. Boom. There we see. We try to organize it where we're, hopefully for us in the gym, we're changing direction, moving from block to random practice, maybe contact, maybe not. Small-sided games if we're using soccer as an example, because it's the easiest one to make. What are other things, Moose, that you think that we can, for both of you, like what else can we do later in the phase to continue to make things a little more unpredictable and sketchy and maybe even create a little bit of a fearful situation? What can we do better?
I'm going to circle back to the question that my answer about if you have a kid or an ACL that's not doing well at 11 or 12 months. And that, to me, is communication. So hopefully, you as a therapist and me as an orthopedist and you as a mental health provider, we have communication. So if you call and say, she's not doing well. Yeah. Her quad's not responding. Her knee is swollen. My profession tends to say, it wasn't me. Yeah. that graph looks good. It must be the therapist. Yep. You're not getting a red milling. It wasn't me. But it's important for us to swallow our pride and say, let's look at for me, clinically orthopedist, is something going on in the knee. If at the time of their surgery, did their chondral or articular surface not look great? Yeah. Did they have a meniscus tear that we're like, well, we'll leave that and see how it does. But it's important for the therapist and the athlete, for us all to communicate. And if they're not on track at 11, 12 months, we need to know why, right? And if the athlete or the parent is not getting a why from their orthopedist, get a second opinion. Yep. Because my profession is terrible about saying, great, the graph looks great, you looks great, and they go see somebody else and the graph may not look great, and the quad doesn't look great. So it's okay to seek a second opinion if you're not on track. Yeah. But at 12 months, if things aren't going well, either the therapist, mental health provider, or PEDS needs to know why. Because if it's still swelling at that point, that ain't normal. Yep. If their quad circumference is 3 centimeters down, that ain't normal. Yep. So you need to figure out why. And if we can't figure out why, then if we keep sticking our head in the sand, it's going to be 16 months, and it's going to be 24 months. Yep. Not going to do well. Yeah.
Well, and I'll say something which is purely aspirational, but the three of us are sitting here doing this podcast, right? Sure. So there's relationships, there's experience, not just my daughter, but some other folks that we've worked with. I mean, and there again, me working in the childhood cancer world, like that is very specific. There needs to be the utmost of communication, right? I mean, wouldn't it be nice if, let's use this example, the only one we have, but if the three of us are working with a patient, and what if the three of us put every month 20 minutes on our calendar to get on a call to talk about the three athletes that we have.
Right.
Hey, that probably doesn't even have to start till the 6-month mark or the 9-month mark. And then, so that sort of communication, I think, as the parent, like that would be fantastic. I don't know if that's possible. I don't know how you bill for that. I don't know how you scale that, right? But especially if there's a problem, to know that it can be addressed. It might mean a second opinion, and I would agree with that. But it could also mean, well, let's double down on the team you have. Yeah. And then the last thing I would say, and I've been a assistant coach and everything else, but I mean, a lot of the coaches don't have the knowledge of what to do when you brought a practice time and how to do practice and how to handle game time stuff and could you manage that. They might not listen, but if there was a mechanism or just some information out there that they could understand in general, what you as a physical therapist, what you as a surgeon might recommend. I mean, you can't do it for every single sport, and you can't talk to every single coach and hold their hand. But if there's more education, more knowledge, and a little bit more collaboration, again, aspirationally, that'd be perfect. Yeah, I don't know if it can happen.
Yeah, I think that's great. And then to go to the question you asked me before I got off on that sidekick.
Yeah.
Is there stuff between 9 months and 12 months that you guys can be creative with? I think a quote my dad's, who's passed, one of the best quotes he was a sports medicine guy, and one of the best quotes I ever heard him say was, "Don't complain about what you can't do. Tell me what you tell me what you can do."
Yep.
So if you can't run, jump and pivot, what's your 2K road time?
Yep.
Right. So don't tell me what you can't do. Tell me what you can do. And you guys are good at spicing things up.
Yep.
As they're trying to. You can build some aerobic fitness.
Yep.
You can build some anaerobic fitness without putting stress across the knee.
Sure.
So I think some therapists are very creative and are fantastic, and they say, look, you may not be able to run 5 miles today, but you can row and you can use a skier and you can go to the pool. Yep. There's all kind of cardio stuff that you can build that foundation, and I think that's what I see as across the board. Really, the downside is that we are all focused on knee, run, jump, pivot,
yep.
and we don't drop back to, can you swim? Go to the pool.
Yep.
You can row. Rowing is hard.
Yep.
You can do ski erg. Ski erg is hard. And so if they're building that aerobic fitness, by the time they're able to run, jump, and play, they have some aerobic fitness.
Yep.
So I think that's a way to be creative as we're waiting on the knee to heal and then to get their quad back by suggesting things. Swim, row, do ski erg, all kind of different stuff.
Yep. Yeah, we're kind of, this is a good chat for it, but we're kind of starting to put the pieces together where we're just going to kind of have our own rough protocol for ACL because we're just kind of seeing so much nowadays. And part of that whiteboard for us is like, get outside of your infection risk sketchy period, 6 weeks. We're certainly going to start. I mean, look, we're in a gym, so we're a little unique in that we have both PT and performance, but we can train upper body, right? We can train core, like we can develop, you can certainly develop aerobic fitness on an Airdyne. Everything that you just said hits home, It's a little bit anecdotal, but I certainly hope over time we're starting to think about like growth hormone response and systemic, response for some of the hormone levels that hopefully are improving while we're establishing fitness and stuff, and just educating our people to get on board with all that, and then building in some of those markers along the way, in terms of like assessing readiness and stuff. I think, mentally, Matt, I had one more question for you. Occasionally it will happen. It's easy when you got the go-getter. You just got to make sure they don't do something really stupid, out of the gate. But they're going to do really well. If we have a kid who maybe plays club sports, they enjoy it, they're quieter, their parents, for any parents listening, maybe just push them hard and drive. But we know as coaches and clinicians that we can pick up pretty quick, like, how engaged is that person in this process? Yeah. But they've still got to get through the process. How do we engage those athletes better? How do we get them involved in the process more actively?
I can give you my perspective from the clinical when I'm sitting in the room with them, and I'll give you that one. I mean, but the one thing I do want to say is, again, because I've lived it, is, Kyle, you and your team here, it's the best team I know, very just personally, the connection that you guys have and the trust that they put into you guys, and the openness of the communication. Like you in a lot of ways, I have a clinical one, and I can like pull out certain things, but they're talking to you guys about a lot of things, especially 11 or 12 months in.
Certainly.
Right?
Multiple times a week.
Yep. You got it. You got it, right? So, I mean, and I say that not to be like, well, that's a lot of pressure. I'm going back to our first thing to be like, when you're saying, this is great, this is great, this is great, what do you want to keep working on? It might be okay to kind of always be a consistent vocabulary. Is there something, what are you worried about? Don't ask the question. What are you worried about?
Yep.
What are you scared about? Because we can put something in on that too. So when they hear for months at a time, their PT who they trust going, all right, what are you psyched about? What are you really excited about? What is really giving you hope? And there's always and the answer can't always be male or female. Nope, I'm fine. Don't worry about anything.
Yeah.
It's like, no, like, come on, we're putting that out there, right? Mm-hmm. So that could be something where they just know that's part of the conversation if we model that. But back to your original one, I see that all the time with a injury or not, right? There's a lot of kids that whether they get burnt out, you want to call it that, or they're just they're trying to figure out what's for them at their certain time of life, and the parents might be overly involved. And that's why a lot of people in my profession step away from sports psychology because of the parents.
Yep.
And I have a very frank conversation with almost every parent, maybe not in the ACL work, because that athlete's going to let us know probably before the 11th month, like, here's my goal, this is why I want to come back, versus, you know what, I'm not making it back for my spring season. I'm not playing college sports. I'm going to do a different rehab path. But I'll tell them, look, I'll talk to your child. You just got to know that the outcomes of that might not be what you think they are.
Yeah.
And are you okay with that?
Yeah. Great point.
There again, so that I think covers what you're saying. But I think you're right. A referral to someone like me, just to be like, because it might just be a pause point. It might not be, I really don't want to do this, I quit. When we're about to make steps, we always regress a little bit.
Sure.
And then we jump to the next step. It might just be their emotional fear. They're just regressing before they make that next leap. But if they have someone like me they can talk to, they can work through it and you decide, no, this is where I'm getting off the bus, or no, we're going to put it in fifth gear and let's go.
Yeah. Love it. On topic, and this will be the last one and then let you guys get out of here. You mentioned burnout, and that's kind of the last question that I have. And this is more about our sporting society, I guess, as a whole, right? And professionally as well, for both of you guys. I will speak for myself in sports medicine. We work a lot and probably don't get paid nowadays with insurance the way that I think a lot of us, should at the end of the day. So a lot of what we do, frankly, is for the love of a lot of the athletes that we work with. But there's a lot of pressure there. So either for athletes, or if it is from like a personal take from each of you guys, maybe how do you avoid burnout professionally, and how can we help our kids and athletes avoid burnout as a sporting culture? I know that's a big question.
You take it on first?
Yeah. So, me personally, I work all hours of the day. I work nonstop, but I value family and I value my training.
Yep.
So I know from 4 a.m., no alarm clock. I get up at 4 a.m., hair on fire.
Yeah.
And I will
flex.
I will do my training. I'll do my deal. It doesn't involve my family time. And if I can get that done in the morning, I'm a better person, right? And so I get my training done. I go to work. I absolutely love what I do, so I don't dread going to work. And when I come home at night, I try to focus on those in my house. And I give up speaking engagements. I don't travel to meetings a lot because that's not that important to me. And that's kind of evolved in my career. One of the reasons I left, college athletics, because I wanted to be around for my kids, and I wanted to go to their mountain biking events and their volleyball and all that stuff. I wanted to be involved, and I think I was. And they know my whistle from across the room, so I was present. So I think it's choices you make. I think you have to value yourself and value those around you that support you. And I tell my adult kids every day, you got to love what you do.
Yep.
And it's a lot harder to get burned out if you get up every day going, sweet, I get to go to work.
Yep.
Right?
100%. Love it.
Yeah, I would say for me, it's kind of like, and I try to teach my own kids this, let alone clients. It's like whatever can be done can be undone. Whenever any of us as a human get in really bad spots is when we feel like things are unchangeable or they're getting permanent, and like that goes a little bit beyond burnout, right? You can bring me back for a whole separate podcast about my own experience, but there's a reason why I said I worked for 11 years at the Children's Hospital of Richmond in the childhood cancer clinic, and then I turned into an entrepreneur and opened up a community clinic, right? All three of us are pretty entrepreneurial. At around 42 is when I said, I don't want to do this anymore. I think I did a great job. I had a lot of fun for 11 years, and I just need something different. So I needed to pivot professionally and figure out what to do. I mean, that's part of my own story there, and it is because of family. And we often joked, like, as COVID came and everything else, like, what would our world and my job have been like if I was still at the hospital and everything else, and what do my hours look like, and what does the flexibility now look like? I think you're seeing that now, Kyle, with your own place and the way that you're building it. Like, we need to have flexibility with that. Yep. But that is what we're trying to teach our kids. And that, like, if you're going to go after something, and like we are always, my wife and I always risk like being those parents, because we'll be supportive and we might be more supportive than we even realize. But you try to teach the kids, hey, look, man, if you don't want to do this, you don't have to, and you can pivot. You know, our oldest went from very elite soccer to golf because he felt like it. And then he just killed that.
Can't beat me.
Yeah, I don't know. You sure?
No, he definitely beat me. Yeah, he's gonna beat me every time.
But you know, even all three of our kids have their own story in their relative young years of like they came to us, said I wanted to pivot. We said awesome, you know, and that's just in athletes, but it's also in like a lot of different worlds. So building that flexibility.
I want to make one final point about ACLs before we shut it down.
Yeah, absolutely, please.
I think one super important point is you work with young adults, and I work with young adults. What these young adults have to realize when they tear their ACL and they go through this rigorous process and they get spit out on the other side and they're back doing their sport or living life, take great pride in that. Because ACL rehab is hard. It's hard physically, it's hard mentally. And if you can get back to sport, fantastic. But what you need to take from that as a young adult, a young athlete, you can do hard things, and you take that forward in life. So as we get to the 9, 10, 12 months, and you slap them on the back and say you've done a fantastic job, and I say you look great, go do your thing. We have to reiterate to them as human beings. This is hard. You had your ACL torn, your heart was broken, you suffered for 6 weeks, and now we're 12 months, and you look fantastic. Well done.
Yep.
You can do hard things. So if you're in college or if you're in a job or something bad happens, you can do hard things. So ACL is not fun as a patient, but you can learn from that. You can have courage from that, and just know you can do hard things. So the ending conversation when your athlete leaves out of here before they start coming back 2 or 3 times a week for sports performance is, well done. You can do hard things. I think that's key.
Love it. I need to add no more. We're going to end it on that.
So well said.
Yeah, that's pretty damn good. All right, guys. Thanks for the time. We appreciate it.
Awesome. Well done.